Yeah, I think there's so much work to be done in terms of contextual admissions. Unfortunately, though, and I'm sure you agree with this, and that's so much of the work that Brilliant Club is already doing, the balance needs to be readdressed before then, getting the right education so that they can even pass that. So, for example, just in terms of experience with Oxford, a kid already has to be highly intelligent by the time they reach 18, even for contextual admissions to work. So one thing that you've mentioned to me before is the link between health and education. I think that creates a barrier between North and South. So could you just tell our listeners a little bit about that?
Absolutely. So you've got to start early, right? Like, we know that so much of a child's life is set in the first 1,000 days. And so it really matters what happens in early childhood. And actually access to university, my job's really important. The Brilliant Club's really important. This agenda's really important, but it's the cherry on top of the cake, right? And we should really care about what's happening much earlier. And that's why the Brilliant Club, we work age 8 to 18, right? We're right in there with Key Stage 1 kids doing programs like Can Stars Float in the Bath, which is very complex astrophysics. But the work I've done in Bradford has been all about, in the early years in particular, health and education collide in a really dramatic way. And so if you don't have the health piece right, you can't get the education piece right. So in Bradford, and I've been chairing something called the opportunity area there for about 5 years, we've got Europe's largest longitudinal cohort study. So when you have a baby in Bradford, we will say to new mums, would you like to join the Born in Bradford cohort? And if they say yes, we collect health data about those children. Well, a few years ago, we were able to bring in education data. And this is the first data linkage of that kind in the UK. And it's really groundbreaking, right? I'm so proud of what we've done there, because the Born in Bradford study that looks at this, it looks at the primary school kids in Bradford. And we found nearly 3,000 children who couldn't read, but not because they were illiterate or struggling with their reading. They couldn't read because they didn't have the right glasses on their face. And in some cases didn't have any glasses at all. And so we got money to run a major trial called Glasses in Classes, where we essentially gave children the glasses they needed in their desk drawer and one to take home. And we're currently looking at what that's doing to boost literacy rates. Well, if you get literacy right in the early years, it flows through into mathematical education, science education. You can't access a curriculum if you can't read well and you don't have good comprehension and the rest of it. So for me, that unlocking of health and education is really important. And, for the first time in the UK a couple of years ago, life expectancy started falling. And so I think we're in a real watershed moment where we can see inequalities multiplying and driving each other. And surely a part of the answer as to how we build a more prosperous country where, young children can flourish, but also just more generally society can be productive, is we've got to start thinking about health and education, how those systems interact and how we can work in a much smarter way to get to things before they become a serious problem. So the work on health and education in Bradford is run through Born in Bradford, which is the University of Leeds, York and Bradford. And it is just so inspiring. It really, every time I see it, I get a lump in my throat because it is a remarkable piece of work.
That's beautiful. And you're so right in that physical health intersects so much with privilege, class, education, and I suppose even mental health intersects a lot with those things and the access that people have to mental health services and around mental health awareness.
I mean, some of you might have heard of the Marmot Review, it's aging now. It's about 15 years old, I think. But it was like a landmark review by Sir Michael Marmot looking at health inequalities. And I remember in the foreword from Michael Marmot, I didn't expect to see a higher education access topic right in the foreword, but he said if we equalise the graduation rates of people across the UK, so we offered equal access to folks from poorer, less advantaged areas, I think it was 200,000 fewer premature deaths in the UK. And so you can start to understand the protective relationship between health and education. So everything's connected, is what we say. Everything is connected. And as teachers, we don't get to ignore what's happening in children's broader lives. And as health professionals, we shouldn't be ignoring what's going on in the world of education either.